Hello and welcome. This is Healthy India and I'm your host Lottie Alaric. So well folks, we're all enjoying the monsoon, but as monsoon sets in, it also brings with it a lot many infections, diarrhea being one of them. Now this is a problem that many people in our country face due to various reasons. So much so that the government has now launched a special program to combat this disease. Now what is that program and how are you able to identify the disease, and also what would the treatment really entail? We'll try and talk about all that with a set of doctors who will explain to us about diarrhea and infectious diarrhea, if I can say so. So to take this discussion forward, I have in the studio three eminent doctors, and I'm very happy to welcome Professor and Head of the Department of Gastroenterology, G.B. Pant Hospital, Dr. A.S. Puri. Thank you so much for being with us.
Thank you.
Then we are joined by Dr. Ajay Khera, Deputy Commissioner and Head of the Child Health, Ministry of Health. So thanks for being here. And we also have with us Professor and Head of the Department of Pediatrics from AIIMS, Dr. V.K. Paul. I welcome you to the show. So folks, before we start understanding about the disease and how to combat it, let's all take a look at this report.
Diarrhea is the passage of loose or watery stools more frequently than is normal for the individual. It is primarily a symptom of gastrointestinal infection caused by viruses, bacteria or parasites. Depending on the type of infection, diarrhea may be watery as in cholera or passed with blood as in dysentery. Diarrhea is usually associated with vomiting and low-grade fever. Symptoms of diarrhea include fever, stomach ache, vomiting and watery stools. Although the vomiting typically lasts for only 2 to 3 days, the diarrhea can last for 1 to 2 weeks before it finally resolves. There are many things that can be done to help the patient through this illness, including giving extra fluids to prevent dehydration. Most uncomplicated cases go away on their own without treatment. The best way to manage diarrhea in children depends on how severe it is, what germ caused it, and your child's age, weight and symptoms. So be sure to ask your doctor for recommendations about treatment.
Well, so let me start by asking Dr. Puri that why is it that you see so many patients of diarrhea, particularly in the monsoons?
Well, the monsoon is one part of the year in which the temperatures are fairly high,
right,
and the level of humidity is also quite high, and these two factors are together responsible for making a very fit environment for the bacteria and protozoa to kind of multiply. Additionally, that's the time of the year that we take in a lot of water.
Right.
So if you were to compare it with the winters, when your water intake is low, when the temperature is also low, and some of the bacteria cannot survive. So therefore, because of these reasons, it's the monsoon season. You see, we will see a spurt in all GI diseases related to infections because of these two principal factors.
Right. So Dr. Khera, does that mean that particularly during monsoon, people must be very, very careful, particularly with the kids? What would you say?
Certainly, that's why the recently Government of India has launched a very big program,
right,
which is being called as the Intensified Diarrhea Control Fortnight. And this is going to start from 27th of July to 8th of August. And what is being done is, we are trying to, visit all the families where there is a child under 5 years of age.
Okay.
And then our ASHA workers will go and give the ORS packet. And it is not only ORS packet, they will also do a kind of a counseling. That means how to make the ORS packet.
Right.
So it is a kind of intensified effort. It is not that the diarrhea happens only in monsoon. It happens throughout the year. But during this season, that's why Government of India has launched a very, very special campaign to make people aware that what is to be done, and particularly making them equipped with the ORS availability packets, and then how to use it.
That's right. That's right.
Yeah.
So Dr. Paul, now talking about children, why is it that the babies or the infants are more vulnerable than the adults?
Many reasons. One is that up to the age of 6 months, the infant should only get breast milk and breastfeeding, which is very protective. But after 6 months, the food gets introduced and should be introduced, and child is also getting access to external water. So now suddenly this baby who's never been exposed to these elements and these bacteria, the dirt, and unhygienic, potentially unhygienic situation, is exposed to all this, and therefore suddenly there is a risk of diarrhea in a child who's 6 months and on to about 2 years, and particularly in the first year of life. And then there are other reasons. Other reasons are that the child's size is such that it has more water, and if the child loses water, the dehydration sets in very rapidly, and this can be a huge problem. And not surprisingly, it's a very major cause of under 5 mortality. About 10 to 15% of under 5 deaths that occur in our country occur because of diarrheal disease, and it's largely due to dehydration. And so every year we are losing unnecessarily 150,000 1.5 lakh बच्चों की जान जा रही है. And we have to make a difference to this, because countries in our own neighborhood and in better off countries, there is hardly any diarrheal disease death in children. And that's why it is very important for us to address this problem at all the levels. And Dr. Khera has very aptly described what the government wants to do, but there is a lot more that the families would do, which we will talk about, I'm sure.
Right. So, Dr. Puri, now this is about the children, but what about the adults? They are also, I'm sure, more prone to this disease during the monsoon, as the reasons you just told us.
Yes, definitely. The adults are also more prone to these diseases during this time of the year, as I said, because they're taking a lot of liquids, and sometimes you find yourself in some place that you're forced to drink water or some liquid which you're not sure about it.
Correct.
But your thirst factor is so high that you you have to kind of quench your thirst. But even in the adults, it's the I would put the geriatric population. They are the ones who are
most
and
vulnerable.
it's not wrong to say they're very much like the pediatric population. So you can put anybody above 70 or 65 is more vulnerable, and they again more prone to dehydration. And if that happens, then they go into a renal failure or a kidney shutdown, because that is what is going to determine the mortality. Otherwise, in adults, barring aside a few exceptions, these are all self-limited diarrheas. A lot of them are caused by viruses or even the bacteria that are toxigenic. So they are the self-limiting diarrheas. We will talk about the other ones later on. But these are the ones, and they would typically last 5 days, 7 days, 10 days at the most, and they're self-limiting. But even if you're somebody 78 or 80 or something like that population, in that phase also they can go into a renal failure and get what we say as electrolyte abnormalities. The sodium can go down because you've lost so much sodium in your stools, so you can become a little disoriented. That wouldn't occur in a young adult. So the tolerance level of a young adult would be much more as compared to somebody who was in his 70s, 80s.
Right. So how does this infection really travel? Would you like to demonstrate to us?
Yes, if you can see this model, then I have a model of the large intestine. Unfortunately, there isn't anyone that I could get for the small intestine, but you can see that it's been cut open here, and some of the infections like amoebiasis, they would cause discrete ulcers. If you can see some of the ulcers in the wall over here. So then these amoeba, they can actually penetrate right through the wall, go into the blood vessels, and ultimately land up in the liver, because the liver is the final destination for most of the blood that comes from the intestine, and then they would form large abscesses there. Now that is a localized infection in the liver. It can be a septicemia, because if you have other infections, bacterial infections can again take the bloodstream from the colon or from the small intestine, go into the whole blood, what we refer to as septicemia, and then that affects the whole body per se. So, but by far, it's the viruses don't do that. When you're dealing with viruses, that doesn't happen. In fact, the commonest cause of the self-limiting diarrhea in adults and in children is probably the viral diseases. But it's what we are concerned about is specifically it's the invasive bacteria and the protozoa, which can actually penetrate into the wall.
Right. Now, Dr. Khera, to say that we lose about 1.5 lakh children every year, now this is a very appalling number even for a country like ours. So I'm sure this program is pretty targeted as you're talking about it. So, and how do you really plan to see that it really reaches the last child standing?
As Dr. Paul rightly said, we lose around 10 to 15% of the under 5 children. And we lose around, around 13 lakh children overall. And out of them, let's say around 1.5 lakh, they are because of diarrhea. And that's why Government of India is giving highest importance to this program. Now, in order to address this issue, there are few critical things which have been put in the program. One is, we are making sure that the ORS packets, which is called as the, I will call it, panacea actually for diarrhea. At least in terms of eliminating deaths. And we are targeting in terms of making it as a 0 deaths because of diarrhea, because this has happened in the neighboring countries. And we are making sure that the ORS packets are made available in the remotest part of the country.
That's right.
Like we have the ANMs, we have the ASHA workers. So these ORS packets are available in their packets. That's number one. Now it is not only the availability, even many of the people do not have a knowledge how to prepare the ORS packet.
That's right.
And it has been observed that if I look at the India scenario, a recently survey was carried out and it was found that around less than 50% of the children receive ORS packets when they get a bout of diarrhea. So that means 50% still children do not get ORS packets.
That's right.
So maybe because of the lack of knowledge, maybe because of non-availability. So what we are making is sure that when Asha goes, she gives that education, she gives that counseling, and even she demonstrates how to make the ORS packets. Beside that, all over the country, particularly during this intensification campaign, we are promoting the concept of a ORS corners, ORS demonstration sites. So that means in all the health facilities of the country, we have around let's say 1.5 to 2 lakh sub-centers, we have PHCs, we have district hospital. So you will find everywhere there will be going to be a demonstration site where any child who will have diarrhea, so the parents will be demonstrated how to make the ORS packet. And beside ORS packet, another important technology is the Zinc Tablet. Generally we have seen that Zinc tablets are not prescribed because of a variety of reasons. So we are making sure that every child who gets a bout of diarrhea gets the ORS packet, gets the knowledge how to make the ORS packet, and then simultaneously 14 tablet course of zinc is also given. And then beside there are other advices which we'll talk about.
Right. Also, can you just quickly tell me that this is during the program that you're all going to do this. So once that program is over, so even otherwise if a person goes to these centers, will all these things be demonstrated to them then?
No, generally this is a regular activity. That's why I named the program as intensified. It is not that something which is special, something which is happening all throughout the year. There is intensification during that period. And as you rightly said, during the monsoon season is you find more of diarrheas and obviously more of deaths might be happening. So we are doing intensification efforts. So ORS corners are established in many of the hospitals, but during this time we make sure that the ORS corners are there, demonstration is done, and those kind of things.
Right. So Dr. Paul, now for the benefit of the viewers who may be watching and who may be parents, now what should they do in order to prevent diarrhea from really manifesting itself in their children?
First and foremost, below the age of 6 months, the babies, the infants, the children should only get breastfeeding.
That's right.
And breast milk is protective. Breast milk is protective against all infections, and particularly for diarrheal disease. So that's the first mantra. The second point is that children who are older must have a clean environment, clean food, a clean water, and hand washing.
That's right.
Hand washing is very important, and that must be ensured. But equally important is that the children have to be in good nourishment stage, because when diarrhea occurs, during that period the nutrients are lost. The child who may otherwise be okay or on the borderline of undernutrition, over a period of a few days of diarrheal disease gets prone to become undernourished, and that's a very serious matter. So if a child is otherwise better and healthy and he's been breastfed, he's also taking other food, and is clean and healthy, this child has more chance to sustain diarrhea, and even more important, much less chance to get diarrhea in the first place. So very important that well-nourished children will be protected. Undernourished child becomes even more prone to this. So I would say protection relates to good feeding, breastfeeding, good nutrition, hygiene, hand washing.
That's right.
And of course, we now have a vaccine which will be soon launched, and I'm sure Dr. Khera would like to tell about that.
Well, we'll definitely talk about that vaccine too if it has been launched. But right now, folks, we'll have to slip into a very short break. When we come back, we'll open the forum for you, and you also can ask your questions if they are related to diarrhea. The numbers are 1800115314 and 23035420. Please remember, today we are talking only about diarrhea. Welcome back. This is Healthy India, and today we are talking about diarrhea. So if you have a question that's related to this condition, then this is your time to pick up your phone and reach us at 1800115314 and 23035420. Now, let me come to you, Dr. Paul. We were talking about zinc. Dr. Khera also mentioned. Now, what is the significance of zinc? How does it really go about helping in this disease? And then give us a demonstration of how ORS is prepared.
Okay. Zinc has been introduced in the diarrheal disease program the world over, and in our country also for a few years now. When the child gets diarrhea, the whole intestinal tract is involved, and there is a loss of the superficial lining of the intestine, which has a lot of enzymes, and this lining has to recover. Now, zinc is a substance which we all need as a part of our normal food and diet and stored in our body. When the child gets diarrhea, the zinc gets lost in the intestinal tract. The zinc is gone. And the child needs zinc to recover. The recovery for this epithelium, the lining that has been damaged, is dependent partly upon zinc. And zinc is also required for the inner body, body fluid, immune system, to be able to mount a response during that episode of diarrhea to fight the bacteria or viruses which are causing. So zinc is something very important. And what we know is that if you give zinc in an episode of diarrhea, then the duration of diarrhea decreases. So if the diarrhea was to last, say, 4 days or 5 days, it will last now 2 days. If it was to last for 9 days, it will last 4 days, 5 days. This is very important, because the longer the duration of diarrhea, more is the chance for the child to become undernourished, because it's becoming long, and every day the child is losing, nutrients, becoming weak, and of course at risk of dying because of dehydration and other things. So zinc reduces the duration of diarrhea. Zinc therefore protects against child becoming undernourished in an episode of diarrhea, and zinc also protects this child not to get repeated diarrhea. It protects.
So that means
it's a very
the role
essential.
is really
it's very, very important, and it's a game changing in many ways. And now it's part of the program, and the packets that Dr. Khera was talking about don't not only have ORS packets, but also the zinc tablets, the 14 tablets that we're talking about.
So now just
I'm very happy to show you how the oral rehydration solution has to be prepared. This solution is provided in a packet, ORS, oral rehydration solution. It has sodium, it has potassium, it has glucose, and it takes care of the dehydration and actually reduces the purging of the baby. So what we need is a liter of water. Now, a typical glass is about a quarter of a liter.
Of a liter.
250 ml. So you need 4 such glasses. So I have put 3 already. This is the 4th one gone. Another very simple way to create 1 liter. I'm trying to make 1 liter of water. So 4 glasses, or we have
just take a 1 liter bottle.
1 liter bottle, and you pour it completely.
Correct.
This water has to be clean. When I'm doing this, I should have my clean hands, and the water should be drinkable, nice clean water. Now, this is the ORS packet, and this standard preparation. Government system provides this. There are also private vendors products are available. So I pour the entire packet into this 1 liter of water. And having done that, I stir it so that the salt and the glucose that is contained in this becomes a nice soup, nice
Gets
solution.
Mixed properly.
And after this is ready.
Now that's all one has to do.
This is all what has to do. It's all standardized. It takes care of the dehydration, and then it is to be given to the child in an amount which is dependent upon the child's age.
That's right.
Very important, because what we are aiming is for every watery stool, har baar jab patla dast ho, then less than 1-year-old child should get 50 ml, which means this much. Ya 1/3 of a cup, ya normal chammach, 10 of those, 10 spoons. 1 saal ke baad mein, till about 2 years of age, you need 100 ml. And after 2 years of age, about 500 ml per day. So this is what is required, that for each watery stool, the child gets 50 ml. a bigger child gets 100 ml and then bigger one gets 200 ml. And this child is to be given with spoon, given slowly, and once you have prepared 1 liter, it can be kept under room temperature in a clean environment for 1 full day.
Okay.
As far as the zinc tablet is concerned, this tablet provided by the government is so nice that it's very safe, and you take water, you can even take ORS, and you put it inside this, and after a while it becomes mixed with this, and the child has to just drink it. It just takes a few,
So
it's
how many
already
tablets
dispersing.
does a child have to take in a
1
day?
tablet
Per day.
once a day for 2 weeks.
Okay.
1 tablet
Once a day,
once a day,
2 weeks. For
less
2 weeks.
than 6 months, half a tablet for 14 days.
Okay.
So this is the recipe for child who's got diarrhea. And in addition to this, I must also emphasize, when the diarrhea happens, there are 2 other things that must be done. Breastfeeding and normal feeding must continue. That never stops, because child even at this stage would need even more nutrients.
That's right.
That must not stop. And last one is to remember that if the child has blood in the stool, if child is having too much vomiting that he cannot even take ORS, even after trying very diligently, or the child is becoming semi-conscious, unconscious, rush to the hospital. But for majority of the instances, oral rehydration solution, continuing feeding, and zinc will take care and save lives.
That's
And
right.
you can
So I
see
think
this has all
that's-
become dispersed very nicely.
That's really very well explained, I must say. Now, yes, taking on from here, Dr. Puri, now if a person is having diarrhea and also vomiting, say an adult, now, so how is that to be tackled really?
It's no different from that as shown by Dr. Paul for the pediatric population. Again, we encourage the use of ORS. And here I would like to add, that the doctor is sometimes under tremendous pressure. Anybody who comes with the
Well, okay.
tremendous pressure, that whenever the mother will come with a 10-15-year-old boy and say he has diarrhea. So although we try and convince them these are self-limiting diarrheas, you should not give antibiotics. The self-limiting diarrheas, it can actually work the other way around. It can be deleterious.
Really.
So we have to actually convince the mother or the caregiver is that for these self-limiting diarrheas, what you need is just ORS. That's what you need. And we say, okay, you can modify the diet a little bit. You can have a banana, because that takes care of your potassium losses and gives you calories, and that can be taken, and something a light tea, a soup or something like that, green coconut water, nimbu pani, all these things is what we encourage. And again, even to the point of repetition, we say no antibiotics for these. But that is something the parents don't accept very easily. They rather go to somebody else who will give them some Metrogyl or something else. And so this is what, if I have to give a message today, this is what it is. For these self-limiting diarrheas, please do not expect the doctor to prescribe a course of antibiotic for you. Yes, if you are having a bloody diarrhea, that's a different ball game. So that has alarm signs. That means it is an invasive diarrhea. So that would require some kind of either antiprotozoal or a antibacterial. That must be given. But since the vast majority of the monsoon-related diarrheas are these self-limiting diarrheas, they should be handled at home, unless in these 2 or 3 conditions where Dr. Paul was talking about, the pediatric and the very young, and as I mentioned about the geriatric. They are the ones who really need a little bit of extra care. Otherwise, these are, you kind of just pass through them.
Right. All right. Now, Dr. Khera, kindly take this opportunity of telling us what is the vaccination that is there, that is to be given, and how effective it is.
Now in the context of diarrhea, the kind of vaccines which are available to prevent the episodes of diarrhea, one of the vaccine is called as the rotavirus vaccine.
Yes.
You must have heard about it.
Yes.
And rotavirus is a very common infection. And we say around 30% of the diarrhea episodes which happen, they are because of rotavirus. So there is a sense in giving a vaccine which can prevent 30% episodes.
True.
So that's why the government of India decided, and now we are lucky that we have the India-made rotavirus vaccine, and we'll be able to introduce. And now the government of India decided to introduce rotavirus vaccine in the universal immunization program in a pilot phase. But it is available in the private market, but you will find even in the universal immunization program. So that's number one. And beside that, vaccination, broadly speaking, is a very well-known, cost-effective preventive intervention. And even there is a role of a measles vaccine. Why? Because measles vaccine, because if the child gets measles, child gets undernourished, and then the child gets into bout of, he gets infections very early.
True.
So we also say that we promote kind of a vaccination of all kinds. But if you are talking about diarrhea in particular, then rotavirus vaccine is one, and second is the measles vaccine. So these are the two preventive vaccines, you can say, which are available. But beside that, prevention, obviously, the so-called the hygiene, hand washing.
That's right.
I think we must emphasize
on that.
That is the
Yes.
important cause of diarrhea in children, and we must advocate for all those kind of following the good hygiene practices. And then the third important thing is the so-called the optimal infant feeding practices, feeding practices.
Yeah,
I think that has a major role. I think.
Right.
I think the message must go very clearly that diarrhea and nutrition both are interlinked. It's kind of a vicious circle. The child who gets diarrhea gets undernourished. Child who is undernourished gets diarrhea. So it's a kind of vicious circle. So we have to break the cycle. And when we are talking about diarrhea, I think in the same breath we need to talk about the kind of the feeding practice.
That's right. So folks, it's time for us to slip into yet another break in the show, but when we come back, we'll be taking in the calls as well. So do call us. Our numbers are 1800115314 and 23035420. Diarrhea is what we are talking about today. Welcome back. This is Healthy India, and today we are talking about diarrhea. Well, we've just learned as to how does the infection really manifest itself and what is the role of ORS that has also been demonstrated. But now I want to ask you, Dr. Paul, that when is it that a person has to start taking ORS? Because sometimes one may really not know, and one is going to the toilet and coming back, and when should that be started? And in case if they don't have access to these packets, then what is to be done?
ORS has to be started as soon as a watery diarrhea sets in a child. Because ORS is basically compensating for the loss. Diarrhea is causing extra loss from the body, water and nutrients and salts. So this is to be given the very beginning when the diarrhea sets in. And that's why we link it to diarrhea. We said that for each diarrheal episode, each watery motion, this much amount has to be taken. We have talked about this. But also equally important is that in addition to this, breastfeeding should continue, food should continue, and normal fluids should continue, home fluids should continue. That part is done. But ORS takes care of the losses in a very unique way, not in an ordinary way, because all these salts have been calculated properly, and they take care of the salt and the water recompensation in a very particular way. If you don't have ORS, then the substitute is घर में लस्सी है नमक वाली, वो दे सकते हैं, नींबू पानी शिकंजी वो दे सकते हैं, और नहीं तो स्टैंडर्ड में ये ग्लास है 250 ml का जो है, इसमें 1 चम्मच चीनी डालेंगे, 1.5 चम्मच 1 चम्मच चीनी डालेंगे और 1 चुटकी नमक डाल के उसको घोल के दे सकते, नॉर्मल शिकंजी, ताकि टेस्ट भी बन पाए। और नींबू की बात कही गई है कि उसमें थोड़ा टेस्ट भी बन जाता है, कुछ और भी कुछ आ जाता है, पोटेशियम जैसी चीज़। तो ये होम फ्लूइड जो है उनको दे सकते हैं, और होम प्रिपेयर्ड शुगर सॉल्ट सोल्यूशन हम जिसको कहते हैं वो दिया जा सकता है। एंड दिस इज वेरी इंपॉर्टेंट। देन योर सेकंड क्वेश्चन इज व्हेन टू गो टू द डॉक्टर, व्हेन टू गो टू द फैसिलिटी। पहले ये है कि जो बच्चा इज पासिंग टू मच ऑफ पर्जरेट, कि दे भी रहे हैं उसके बावजूद भी बहुत ही दस्त हो रहे हैं और मुंह से देने की कोशिश कर रहे हैं, एक्सेसिव वॉमिटिंग इज टेकिंग प्लेस, अ फेलो इज जस्ट puking it out repeatedly, और फिर फेंक रहा है। इसका मतलब कि हम ओरल रिहाइड्रेशन से अंदर की कॉम्पनसेट डायरिया की जो लॉस हो रहे हैं, we are not in a position to do so. If there is blood in the stool, the child should be taken to the hospital. If the child is becoming unconscious, listless, lethargic, should be taken to the hospital. And if the child has not passed urine for 6 hours, that's a serious thing. So in these situations, take the child immediately to the hospital, and this child will need some other ways of looking after. Equally important is the fact that if diarrhea, even if it is going on mild, has not recovered in 2 weeks' time.
2 weeks.
Outer limit 2 weeks.
2 weeks.
This child must reach the hospital, because now we have to find out other conditions which cause diarrhea. It is not the usual diarrhea, and now even more emergency, because this diarrhea is also, for sure, is now causing severe problems or upcoming problems of undernutrition. So this child's nutrition is suffering, he's losing nutrients. So if the diarrhea goes more than 2 weeks, this child must be seen in a hospital by a health worker or a doctor.
Right. Well, so this is about kids, but Dr. Puri, tell me, how about the adults? Is the threshold also 2 weeks for the adults, or is it more or less, or what?
Okay, we classify diarrheas into acute and chronic.
Right.
And the dividing line between the two is taken roughly as 3 weeks.
Okay.
So anything more than 3 weeks or 4 weeks would come in the category of chronic diarrheas. And there are numerous causes for chronic diarrhea, which I don't think we can discuss in this session. We are focused on the acute diarrheas, and which are usually less than, they should be all over within the first 7 to 10 days, but still we give an outer limit of 2 to 3 weeks.
Right.
And if they persist beyond that, then obviously there's something, it's not run-of-the-mill or not the garden variety. So there's some complication has occurred or some. So for example, you can have, enteric fever is one condition where you can get fever as well as you can have a diarrhea. And later on, you start with a watery diarrhea, and then the diarrhea becomes blood. Now that is alarming, because that means some kind of invasion has occurred or some ulceration has occurred where the blood is coming from. But otherwise, it's not very different from what Dr. Paul has said. We also go by the fact that, if the patient is not passed urine, now that is an alarming sign. And especially in the elderly, that would be, again, a confused elderly person would suggest that his sodium level is low following the diarrhea. And sometimes in the elderly, you can even, their hands become shriveled, what we call as washerwoman's or something. These are signs of dehydration, where the skin becomes kind of, not as the normal skin, but it becomes dehydrated, and you can actually, somebody who's alert would actually pick up the signs. And so these are, they're not very different from whether you're a pediatric, adult, or a geriatric.
Right. Now, Dr. Khera, talking about this program, now once you launch this program, will it also be, are these campaigns going to be carried out even on the electronic medium and the newspapers, and what have you planned?
No, I told you that from 27th of July, there's going to be 2 weeks, kind of complete fortnight.
Right.
Dedicated to preventing and controlling diarrhea.
Right.
And the elements of this campaign are, number one, because we have around 1 million of ASHA workers, around 9 lakh ASHA workers.
They are your foot soldiers.
Every village has a ASHA worker. Now, ASHA worker is now going from every house. There's the beauty of the program, that now we are trying to reach each and every family where there is a child, where there is a potential that the child will get diarrhea. So we are going not only with the ORS packet, we are also going with the message. So that is number one element of this whole strategy. And then the second element of the strategy is ORS corners getting established all over the country. That we say we have around 1.5 lakhs sub-centers. I have around 40,000 primary health centers. We have around 600 district hospital, and so on and so forth. So all over the country, all health facilities will have ORS corners. Now another important thing is, because diarrhea is not only the health department responsibility. We are also working very closely with the school department, like the schools. We are also working very closely with the PRI, Panchayati Raj institutions. And I'll tell you that last year when we conducted this campaign, even these ORS corners were established even in the non-health facilities. Now this time also you will find that the ORS corners will be established even in the schools, even in the Anganwadi centers. And I am so happy to tell you that even the Indian Academy of Pediatrics, like all the private doctors, they have also come together, and they have also made a commitment that during this fortnight, every clinic will have this particular, ORT corners, where this demonstration will happen, where the Zinc Tablet will be made sure that it is made available. So that is the second element. And then the third element of this whole strategy is that you will obviously use the mass media campaign. We'll use mid-media campaign, posters. There will be kind of a lot of festivity, around it, so that the people get aware. And I told you the background is because less than 50% people know that during diarrhea episode, ORS has to be given.
That's right.
So we want to, give this message across the board, and we want to improve the coverage from, let's say, 50% to 80%. And then there is going to be, a lot of kind of a debate, competition, even in the school. Because after all, the children who are studying in the schools, if they get a right message, they will go back to the families and give the right kind of a message that why diarrhea happens. And the most of the diarrheas can be prevented actually.
That's right. That is right.
If people take care of the hygiene and if they understand the basic mechanism, the genesis, it is preventable.
Absolutely.
And the deaths can be absolutely, eliminated. I call it.
True.
And I think we are working in that direction. And hopefully, we should be able to improve our ORS use rate in the country. We should be able to make people aware that why diarrhea happens, how it can be managed. And obviously the vaccines and those kind of things will also be part of the program.
Right. Now, Dr. Paul, as far as children go, sometimes it's very difficult for the parents to contain them, in terms of eating. They may not really know that this is a time when they cannot really have certain greasy foods or what have you. So as a doctor, what would you really let them have? Let them enjoy eating, if I can say that.
Children should enjoy eating.
Yes.
Whatever they eat is should be clean, protected. Food which is prepared should be covered. It should be fed by the care provider, the family, after washing hands. Should be clean. Child should be encouraged to wash hands because the child is moving about, as you very correctly said. Ultimately, it is the balanced food. Food component has to have rice or wheat. Dal, which is protein source, or egg or non-veg, which is the protein source. It has to have a milk as one of the important components, and green vegetables. So it has to be balanced.
I'm glad you mentioned milk, because most people think that when the child is suffering of a bout of diarrhea,
milk is good food. Milk is not to be discontinued. No food which the child was taking normally is to be discontinued. Normal food should continue. What you avoid is, don't add too much of chilies and masalas because that will be irritating.
Right.
One thing which Dr. Khera pointed out, I want to take it forward, and that is that the time has come that our country really eliminates the deaths due to diarrhea.
That's right.
It can be done. There is one dimension of diarrhea elimination which is related to overall sanitation, cleanliness, water, hygiene. We are embarked on that. We are now Swachh Bharat कार्यक्रम, and we will get our environment right in a finite period of time. But in our neighboring country like Bangladesh, where the conditions are worse, right? Still, using the approaches that we have been talking about, nutrition, oral rehydration solution, and zinc, the diarrheal deaths have been reduced. Our 10-12% deaths are occurring due to diarrhea in under 5 children. In Bangladesh, this is down to 1 or 2%. So it's possible to easily save about 1.25
so does that mean
lakh.
that the program that they follow is really...
They have done it with more rigor. You see, our ORS excess is 60% or 55-60%. Theirs is 70%, 75%. So we have to move in this direction.
Absolutely.
That even when we wait for things to improve, we can make a difference.
Absolutely. I'll have to interrupt you because time for us to slip into the last break of the program. So people don't go away, as we are coming back in just a moment. So do stay tuned. Welcome back. You're watching Healthy India, and today we are talking about diarrhea. Now, Dr. Puri, would you like to take on from where Dr. Paul left, saying that milk is something that can be taken? Now, what about the adults? Because the moment diarrhea sets in, everybody will say that, okay, don't have milk, don't have curd, but what is the doctor's order?
Okay. Now, milk is, as Dr. Paul mentioned, is an excellent food, especially for children, growing children. No doubt about it, provided it is clean and sterile. Now, if you take overall cases of food poisoning, then milk and milk products, they come right on the top. And so milk and milk products are very prone for food poisoning.
Okay.
So if you're not sure about the quality of the milk, about the sterility and the cleanliness of the milk, I would say that you should avoid milk products. If you're going to some party or something, you're not sure. And so this is the best. And I tell my, whenever I interact with people, I tell them, if you can avoid cut fruit, cut salads,
that's right,
milk products, and the street food mein jo chutney वगैरह होती है. So if you can avoid that, you've really eliminated a lot of things which can cause these infective diarrheas. But otherwise, and it's all very well to say to have bottled water. Sometimes you can't have bottled water. in that case, the next best substitute is to have boiled water.
Boiled water.
If you
right.
can't have boiled water, have tea, hot tea or something, because anything which is boiled, you see, most of the organisms are killed.
Correct.
So that automatically you converted something which was unclean into clean by boiling it. So this is the time of the year that your liquid intake, because of the thirst factor and the fact that you're sweating so much, the thirst factor is there. So you tend to take in much more liquids there as compared to, say, December or January.
True.
So here, that's where we go wrong, and we end up eating something or drinking something that we shouldn't be, and we're not sure about its cleanliness.
Right.
So that's the message I'd like to give, that if you can, convert. I'm not an advocate for bottled water at all. You can easily cut down the cost by just boiling.
Yes, absolutely. Now, Dr. Khera, hygiene, I think that can never be too emphasized, because hygiene is one thing. If we really maintain good hygiene, then a lot of these infections can be cut down. Now, is there anything particular that you want to say in this regard as to how careful should parents really be?
I think the point which you raised was regarding the hygiene. And I think hygiene and the diarrhea, both are very closely linked.
Related, correct.
But one of the important message in the context of, particularly in the children's diarrhea, and it has been observed that one of the major causes, use of bottle feeding.
Okay.
Because generally we have seen the mothers who are giving, bottle feeding. I mean, they don't clean the bottle, they don't clean the nipple, and also it is very cumbersome to clean every time.
That's right.
So that's why we all recommend under the program that bottle feeding should be avoided as far as possible, and that's why we say exclusive breastfeeding for 6 months.
Right.
And when we say exclusive breastfeeding, that means even no water, and that means the breast milk is absolutely sterile, and there's no possibility of any infection. So at least for 6 months you prevent your child with any diarrhea, and it is not only in terms of preventing diarrhea, even the so-called the development of a child is also very good. I mean, if there are many studies which indicate if the child has been exclusively breastfed, I mean, their overall mental development, beside physical development, is very, very good. So that's the second important. And then when the complementary feeding starts, because the breastfeeding is not enough beyond 6 months. I mean, something extra has to be given, but it is a very, very common kind of observation that people start using bottle. But I will suggest, and even within the program also, we recommend that you should give milk with the katori and chammach.
As simple as that.
As simple, very simple. Maybe the child will spoil some milk, doesn't matter, but at least the repeated bouts of infection will not happen. So I think bottle feeding is to be avoided, which has been found to be one of the important cause of infection and diarrhea in children.
Right. Now, Dr. Paul, what about those children who keep getting these bouts of diarrhea repeatedly? Once maybe it happens and the child is fine, then maybe after a few days again and then again. Now, how dangerous can that really get for a child?
This is a serious matter, because every time the child gets diarrhea, there are consequences. There's a risk of even dying and severe issues and undernutrition. So if the child is getting repeated episodes of diarrhea, this child should be examined, this child should be evaluated by a doctor. At the same time, family should also introspect that in their household, is the food being properly protected, is the fly problem in the household taken care of.
Hygiene standards
are good. If there's in a more middle class family, there's a maid who's looking after children, what is her hygiene levels, and so on. And how is the food kept, and is the child getting food, street food from outside? The points Dr. Puri very elegantly highlighted. But if that is the case, address that at that level. But it is important that this child should be examined by the doctor to find out. There are significant problems that need to be found out by the physicians, and investigations need to be done. This could be a gluten enteropathy, this could be amoebiasis, this could be other malabsorption syndromes, and sometimes the situation can be very tricky and dangerous, and therefore a child who's getting repeated diarrhea is a child that we want to take care and to ensure that the investigations are done and treatment is instituted.
Right. All right. So, Dr. Puri, now what is going to be your take-home message for the public who's watching today?
Okay, my message is very clear. It's prevention is better than cure. It's as simple as that. So I would tell at least the younger audience of this show that learn to identify the foods which might get you into trouble.
That's right.
Now, but that would mean avoiding, say, pani puri and things like that. And I should have mentioned also, it's mayonnaise is one of the most common causes of food poisoning, because that again, mayonnaise is used in burgers and hot dogs and
sandwiches and in just
everywhere.
about everything.
So those are the things. I almost to the point of repetition: cut fruit, cut salads, mayonnaise, and some of the milk products.
Yes.
These should be avoided, and you should be having care. Anything, if you're at a party or something, anything which comes from the oven is absolutely safe. So if you're having a tandoori roti or something which is heated up, that is relatively totally safe.
Right.
That's the bottom line.
Right, right. Yes, Dr. Khera, what would you like to say at the end?
At the end, I think 2-3 important things. One of the important is that continue feeding. Generally it has been observed that people stop feeding their children, particularly during episode of diarrhea. So please, number one is continue feeding your child when the child has a bout of diarrhea. And second thing is big no to the bottle feeding, because that is also one of the important reason. And third, obviously, is when there is an episode of diarrhea, use of ORS and zinc tablet. I think that can really save lives, and we can prevent large number of deaths which happen in the country. So promote ORS and zinc use. That's all.
That's right. Yes, Dr. Paul, what would you like to say?
If there are danger signs, repeated vomiting, non-passage of urine, child becoming listless, blood in the stool, go to the doctor in addition to the therapy that has been started. And I think the biggest message is that time has come that we have to just eliminate these deaths, and it is within our technology is available, treatment is available. These deaths have to be brought down, and that should be our mission.
Absolutely. Well, so on that note, I'd like to say thank you to 3 of you for coming today and for talking about this condition, which can easily be prevented provided we use a little bit of our minds and our intelligence. So thanks a lot.
Thank you.
Thank you.
So, well, folks, if you've watched everything carefully, I'm sure you must have taken a lot of points home. But before I wind up, I would like to tell you that please write to me on this address if there's any feedback that you would want to give us.
FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com, and our toll-free number is 1800115314.
So, well, folks, the sad news is that 1.5 lakh children die of diarrhea in our country. But the good news is that this can be prevented, and prevented easily. All that you have to do is maintain your hygiene levels properly, and if you have little babies, just breastfeed them up till the age of 6 months, and after that be very careful as to what you give them, maintain the hygiene standards, and in case the child does suffer of diarrhea, then ORS is what you really have to give to the child. And if you if you don't have access to these packets, then Dr. Paul just told you as to how this can be done at home using a pinch of salt, a teaspoon of sugar in a glass of water. That's all that you have to give your child. And even as an adult, please use this and don't go and buy over-the-counter medications, because as Dr. Puri said, that this is a self-limiting disease in most of the conditions. So if it is over within a week or two, it's fine. If not, then you've got to go to the nearest medical facility. So see to it that you participate in this program that is now going to be launched by the Ministry of Health, and I'm sure all of us can do it at our levels. All we have to do is maintain our hygiene levels, and I think that's the answer. So we can prevent this disease very easily. So thank you so much for watching. Next week I'll be taking up another health issue. Till then, this is Lottie Alaric saying goodbye, and take very good care of yourselves.